My better people, how far? Hope say all man they fine. Hope say all man come fine. So today na another episode for Better Torpoh, and for Better Torpoh today we dey language on a story with some medical doctor. His name na Dr. Bill Mbianyor. So we gonna stay tuned, and just after the break, me and Dr. Bill will dey language on a Better Torpoh.
But I'm expressing myself and people connect to
you.
it.
Never go for bar, you drink, then you beg say you know fi pay.
Just focus on yourself.
I'm single for Better Torpoh.
I'm sorry. You know come with the chief.
My gift. Dr. Bill, how far?
Ade, we thank God for you.
Ade, how life, how outing?
Life they fine, nothing they fine.
All right, so I don't know you for, how many years now? Plenty years.
Yeah.
And I know you as medical doctor. I don't always know you as medical doctor, you know. But now for any person we don't know you, how you do introduce yourself? Because I know say besides medical doctor, you could surely get some other things you do.
Okay, yes. So I be medical doctor as you know me first. And then I be writer. So I write short stories there. Yes. And then I be picking for Papa God. I like for talker.
Yes.
So make country people they know vex, but I be picking for Papa God. So and then I be also leader. I believe so because I be very involved in youth leadership and for encourage young people for live and for build better destiny them, better play part them through life. So yes.
Wow, interesting. So tell me about, medical doctor. When I hear medical doctor, I just think 7 years. You get a medical training for Cameroon?
Yes, for Douala here.
Okay. For Douala, how be the 7 years?
Yes, 7 years. I'll tell you that 7 years will be very, very stressful first.
Imagine.
Because you enter school, I'll come up as a doctor, but you don't know all the roadway there ahead. You wake up in the morning for 5 o'clock, sometimes then you get for run first, go hospital, stay for hospital, run from hospital, go for school, come back for hospital. Your friend that married, your friend that born picking, you know if you attend married because you dey hospital, you know if you enter married too. So it be very demanding as a medical doctor.
But wait to be drive you for enter the field. Now see where we just feel say na passion, or even that kind of way your parents that we talk say we must get doctor and are you.
So I go talk to my papa a prayer them. Cause I know we ever want really be doctor. I be want be lawyer. Yes, it been my passion from small picking because I be feel say plenty poor people they suffer injustice, and so for my heart I really be want help poor people them. So I feel say law we be not the way for empower people them. But then as I be grow, I do sciences, I be want do space engineering, and I be very good in physics. So my papa be see and maybe they pray for your heart say well you want doctor. My papa a biology teacher. Okay. And he don't train plenty doctor them. And so he be really want the own doctor, he pray. So for lower seat I be school nurse. So I be like the infirmarian for the school. I take care for sick people then. And the school nurse be tell my papa say, they are picking, he must be doctor. So I be tell God when I finish school, say, well, if you want really be my be doctor, I go write this concours and I go write now only the concours. If I no pass the year, I go stay 1 year for us and then decide next year I go continue my thing. But no doctor work. So as I write that concours that first year, I pass. I just not say, well, God don't call me, yeah.
So tell me how we did, from time when you come out school to integration, how we did with your first work within outside?
So by God's grace, I start work already even as a medical student. I began some my teacher where I be work with for Lor'Terre for surgical department. He be really like the way I do work. So we get some clinic. He be invite me for can start work with for that clinic. So now for there I be start work as a medical student by my level 6. But being just mostly observing, follow up for patient them. And then after that, I be come out, I be go for hospital for Boya. When I be come out school immediately, my sit here, I be get to employment for hospital for Boya, where I know God the name, so that one not do. But I did I work with that hospital for some time. And then from there, before I come out now, enter the more professional, I would say, the entrepreneurial space. So I be work with company. Some company for telemedicine, this is where they call them, where you fit talk for your doctor over phone, and then that's why they struggle for put together my own platform.
Okay, so I want to know how it be day. More talk about your experience of working for hospital. Then when you start work professionally for hospital, you don't ever work for public hospital, Cameroon?
Well, I don't train for public hospital, but I never really work. I don't work with plenty public hospital, but as a public doctor for inside public hospital, I never really work as doctor. But I don't train for La Cantini, where will be in a public hospital. Yes, and I don't train for Hôpital General as well. So I don't work there as this thing because for city you do work now. You be doctor, they call you small doctor, so you see all patients then before you call. So in my training at the hospital, I don't work with it.
So, I mean, one know plenty people get a notion, say, public hospital for Cameroon, they don't be efficient, say doctor, they don't be efficient, nurses, they be rude, they need to work on time. So you especially way, it don't work for day. What's your opinion about that kind of talk people they talk?
Well, obviously, I would talk, say, country people, them will be a bit overly critical. Now, just say we're there for country, plenty things they know they fine. But we learn at least for appreciate the thing the way they define. So natural for hospital, like for any other setting, if you go for bank, some people they feel come out on house, it maybe never chop fine, they don't query, so it could be a bit rude to talk. If you get that thing for all place, all side, not be only for hospital. Natural say also for hospital people they expect say as doctor you get for be kind, you get for be patient, but we be human beings as well. So I know feel say for public hospital them, I really feel say over the years the standard don't really improve. In my experience, because even for regional hospital for Boya, I don't spend some time for the. I don't see plenty doctors will be more cautious about their duties towards the patients, and even nurses. They understand their duty to care for a patient, but as any human being, you feel for once or nurse way, you know, chop fine, or you get problem with the massa, and any poor younger for you, and that's in the be very normal.
So not fine for use that one for just like all
hospitals,
nurses or all hospitals.
Yes.
Interesting. So you don't, for your experience or you don't see something the way they make you feel bad, say, now which kind of like you don't get some experience where some nurse be negligent to a certain extent, or some doctor do something where you see and say a negligence, where for your mind you feel say, but why the person feel that kind of thing? You never get that kind of experience?
Yes, of course. I no go hide them. Negligence, sometimes the negligence it be, sometimes it be unconsciously. No be say, well, the doctor be really want to do up or do you bad. I just say be forget. Because medicine they evolve every day. Plenty things that they change. Now so we talk about new vaccines, COVID don't come, we get for go back again for school for learn how that disease. So plenty things that they evolve. So sometimes the negligence be unconscious. Sometimes then too they be conscious. Say, well, I get for do the thing, but I don't really tire. I will never make my colleague can do it. You see. So that kind of thing that they be in any human setting, as I feel say, you get some degree of negligence. But the overall thing goal, at least for me, I say doctors and nurses them they really try their work now for save lives. And I feel say any man we day for hospital, they work with that consciousness. Say, I day for here for work for try for save lives.
So some particular kind, some particular issues, they way people they highlight on mostly for hospitals. Them this issue of emergency. A lot of times when people want to say person get accident, rush go hospital. You know they get some. I mean the person where they come, they get expectations. And if you say okay, so I don't know the patients come now, so maybe they just start work on toy. You know, maybe so like run me through the process of how it normally work. If person come for hospital with emergency case, what's the normal procedure?
Okay. Before I even go for emergency, I go walk some 2 steps backwards for talk about normal consultation. So plenty of time they would get the case where people would come hospital and if you say, well, because I come first, doctor get for see me first. But in a normal hospital, not be so hospital they work because hospital get what they call a triage unit. So with the separate patient the way they don't come. If pikin for 2 months get fever and it can last man, I be obligated to see that pikin first. Even if you maybe adult man, you don't come for day, you get your own trouble. Because that one na pikin, and I know say pikin the tolerance level, not fit be as adult the own tolerance level. Small time, pikin it in then small seconds, pikin the change, he die. So we do triage for hospital then, but plenty of country people never understand that thing because for other system, the way if you go for bank, you expect say I come first, if you get for save me first. But for hospital now, in terms of who be emergency, who I need for see am first, who need require my attention first. Especially for country then for Africa where we know say the health workers population, like the way WHO don't put them now, about 1.5 health worker for over 10,000 population. So I would say one doctor for about 10,000 people. It be a bit straining because you get plenty of people where they come for one day if you see like 40, 50 patients. You get for no say, now emergencies get my attention first, not be who can first, I go serve them. So now the first thing that, now for come back for your question as you ask for emergency situation. Doctor, when doctor receive emergency, you get for no say you come emergency unit. So any man will already dey inside that unit, now emergency. So doctor, sometimes you come with doctor, now only one, maybe 2 doctors. So I don't talk plenty hospital the day where they get only 1 or 2 doctors and you see sometimes 40 patients. So you imagine say the doctor attention don't really be for some other man in case, maybe some other man they will don't surely fall high blood or get stroke. I struggle for stabilizing you can with your emergency. So I no go fit first commode that patient where I never at least put it for some stable condition before I go for other patient. So wait till we this always sometime do I say we send nurse them say okay well go first, take vitals, nothing, the blood pressure, a temperature, just a basic evaluation where they don't train nurses they have to do. We'll see exactly where to be the situation. Then when I finish stabilize this man, I go cancel him. And then we get all country people, they also get for understand, say, in terms of emergency they dey kind by kind. Wait till you feel say na emergency. For me, doctor, you know if it be emergency. I'll take you some case. So woman will come with the pikin for midnight. My pikin the belly the bite, you know they really be able for sleep. For you in an emergency because he love the pikin, wants to be pikin they fine. But if I look that woman and I look at other man with na diabetes patient, we don't surely get what they call and diabetic coma, so we don't just fall coma. Between that pikin and that patient, for me that patient that pikin get belly way the bite, but that patient where they get diabetic coma, I feel lose at any moment. So for me, not the emergency that in that particular setting. So how would he do with emergency? Then first, as I don't talk, would he send? If the doctor be busy, if he send the nurse, may go evaluate. But now if the doctor not be busy, so let's say you come where I be free as a doctor, I can write for attend for you as a patient. And the first thing for me now, I first get some history, I take some brief history. Wait it happen, who say commode, why they do some basic this thing. So I feel the put it for bed, as I put it for bed, I ask, wait it happen, who say the patient commode, or sometimes they would even see some phenomenon where the doctor they evaluate the patient for our side. Because hospital they kind by kind. The thing the way you feed one for Hôpital General, not be the same thing way you feed one for some small hospital for Tuba, for village, for Bamenda. You see, so if I know say my hospital, I hear that story, I know say well, we not be able for handle this situation. Then for me for waste you time. Sometimes there's a doctor the feel say well, I prefer for refer you. When you go side where they go, just take care of you immediately. So now doctor they get for George plenty in them, especially because we will be in a country where we call them low underdeveloped, so low and middle income country. So we will not get all the resources them. Not before any hospital you go enter where they do all kind of things them. So the doctor get for evaluate what is the best line of action for this patient. I keep you for here, I feel happy, or ma send you, or I feel first doing some basic this thing treatment, put here at least an IV line, made fluid then the pass before I send it. So doctor they do all this evaluation before you know exactly, depending on the case, waiting for the whether I go keep it, whether I go send it.
All right, so we'll take some short break and then we'll come back. Me and Dr. Bill will continue on a better Torpoh. Okay, some particular video do we go viral sometime where some person they bring some pikin for hospital. They say the pikin and mommy they be involved in some accident, so the pikin mommy don't die. So the pikin now it be they like almost unconscious. So they carry bring it for hospital, and then the nurse will be done call for night. So the nurse now will be done on duty, be the make phone call. So it be explain for the people and say this. So I get for call the doctor for actually, you know, waiting for door something. So maybe they make phone call, they call the doctor. But now the person wake up with now be very, very impatient, and maybe they holler the nurse. But thank God the nurse be keep it cool. He finish make a call, and then he come now start attending to the picking. So for that kind of situation, what I may explain for we, you know, wait till the nurse be do it call, because some people feel say why the nurse be make call, who's that doctor be there, why doctor not be there, why the nurse make that call, why the nurse not just run carry the picking go with it for hospital, try for the, you know, the do something or whatever. So wait to be the normal procedure for that kind of situation, because I feel say from my own knowledge what I get, I know say nurses they get limitation in the kind thing the way they execute them, and in authority too. I feel like say so nurses they don't get authority, nurses they don't get authority for those certain things them without a doctor authorization. That's in that way I know. So try educate we on how what's the normal hospital procedure. Okay,
so first, for talk about that video, I don't see that video, but I don't feel exactly comment on every aspect, because plenty, as I don't tell you from my experience, plenty things that they happen. But I go first talk about this notion before I address them. I'll talk about this notion for making video for hospital. Now, true say all man is struggle for protecting rights, for capture weight, it don't happen and so on. But I feel say make country people at a certain level be objective. If my objective now for save a life, I don't pick some picking, I don't come hospital. I feel like saying nurse not do anything. 1 minute don't pass, 2 minutes don't pass, 3 minutes don't pass. What to be the objective for me for the make video instead for carry for the next hospital? It did like I enter for bank, customer service no receive me fine. I think go for the next agency for the bank, you see. But if my objective really now for spoil the system, then you get that kind of notion where picking the die. Doctor, I don't know if doctor be there or not be there, but picking the die. But the other person, they make video. What to be really your objective? Now the first question that way me I go ask them. Now the second thing now for come up for address that particular case, I'll talk to I don't know the details of the case, but the normal procedure for me, at least for doctor, where I don't see and I say, when you come hospital for emergency, doctor at least he come first. Look, as I talk, they ask you as this thing, why they do some small basic care. So they take your IV line, they take your blood pressure, they take your temperature, they try for see exactly as they didn't know the story. Now, because now emergency doctor not fit take all stories, so they assess, they do a first evaluation. You don't assess the patient, no say, okay, well, now surely this. And in that assessment, you know, say, now these are the emergency things to handle, these are the things that I cannot handle here. If you see nothing where if you handle them, it put you for bed. Okay, start so, do so, put this medicine, put it, give instruction for nurse. The nurse that they work with your family member, they call your caretaker. Now, in the case of that way, an accident victim, where we don't know who be family, who be who, the emergency now for save life. So I feel say yes, maybe the nurse get for receive the picking, do some small evaluation at what she wound them, that kind of thing them because I imagine say na accident, so picking just blood, that kind of thing them. What she wound them, evaluate if the temperature, if it be stable, if you need blood, that call doctor attention. If you happen say doctor no be hospital, for me at least rather than for admit that picking, wait till I go do at least as a nurse where they attend now. I go take IV line and say well. I don't put it at least made that in the day, made that IV line access day. Doctor no day, please run to the nearby hospital. You see. So for call doctor, it be fine. But I don't know, as I don't tell you, I don't really talk for exactly for that particular case, all the details. Yes.
So other things today way it be very, very pertinent for hospitals. Then wait and the fact say some people they come for hospital, they don't pay bill, and then maybe like they keep them for hospital. Some people they don't born. And they no fit pay, they keep them with their picking in the hospital for weeks and weeks until they fit pay the money where they owe. You know, wait to be you as person in a health personnel, medical personnel, educate we on what to happen for that kind of situation, because some people they feel say it not be fair for keep person or person for hospital because they owe the hospital because they never pay. You know, people they get different opinion them about them. But you as medical personnel give we an insight on how it function for normally for hospital.
I feel say country people they mix hospital with charity. You don't ever go for bar, you drink, then you beg say you know if you pay. And I feel say that same mentality people they carry enter hospital. Because if now we see time for party, we see all man can't drop pass people they buy mayo. But people they not they prepare say my health be important. I feel keep some small money for some side. I feel the save even now 1,000 than for drink beer, than for do the thing they want to do. I feel the save so that when emergency come, I get at least if now 50,000 where I feel give doctor say hold and first start treatment. Because if hospital get for big charity way, would they just dispense care? Would they dispense care? We need to look back. Hospital will go collapse. Déjà que the government, the fund healthcare funding for Cameroon, no be very high. So now hospital they get for think how they go raise money for continue for the function. Now is it right for keep patient for hospital before you know if you pay bills because you know if you pay bills? My honest objective, my honest answer go be well it depends on the case because I don't see case the way you take care for patient. You know if you pay bills then you run. He run hospital. I began some emergency out for like Kentini. That man he get the blood around 5. So in an emergency we get for transfuse, he will transfuse plenty blood. About 6 pints. Where 1 pint for blood, you first do tests before you do all that tests them now about 40,000 when you don't spend them for do that, prepare the blood for transfuse. Imagine say you give one person 6 pints now 240,000 that and then he run. After the man be did 2 days, 3 days, he don't be stable. The next morning one come back, we no see you for bed. We get for send police for go for a quarter, go find him. So imagine plenty dishonest people they where they handle healthcare, let's say no, na charity, doctor because doctor get for save life, he just get for take care for me and am I right? But no be so. So me I feel say it depends on the case. If the patient really no fit keep pay bills, something the way they call them would first take care for the patient as emergency situation. And then after would say, okay, well we feel release you, but you go sign an agreement with we because some other hospital they do that one. So you will sign an agreement, say every month or every week and as you fit pay, you deposit it na 10,000 so you don't flop your bill. Also hospital they get in where they call on social welfare. Some hospital they say they send you for social welfare department for really big hospital. May you go see social welfare go evaluate your case. It's kind of really true say this person no fit pay bills them. Wait till we fit do, we fit send it for this foundation or we fit write the bill send them for ministry of. So plenty option there according to hospital. But I also feel say because country people they feel say well hospital in a place where I suppose get care, they just enter. So like take this case for born. For born pikin, and 9 months you dey carry the pikin, you dey prepare. So for your head, you know, I don't know, but basic thing you don't buy, even napkin, you dey buy it in them. If you do all that small thing, then why you know they even save some small thing for back? Say, well, I feel reach for hospital, so now emergency, I no born through normal road. It be reach here, I be get for do operation. Voila. So how I go do in that case? So I feel say we'll be very negligent as a population on health. We'll be very concerned with other things than for really our health. Now why that would way be important? Yes.
Wow, interesting. Interesting. So we could take some short break. We'll come back. Me and Dr. Bill will continue on a better Torpoh. Okay, so Doctor, we about the malaria vaccine. They don't roll out for Cameroon. You know, Cameroon be the first country, I think, for rolling out Adam for their plan. You know, for vaccinations, especially for small picking them. And some people, they be very, very worried, you know, about the whole thing. So when they be skeptical, say, it's going to be necessary for me to give my picking, you know, vaccine. We don't already be used to polio vaccine. We don't be used to the other one where they put out what they call it, you know, but then malaria vaccine be new. So some people, they fear, say, you know, whether more give more picking, more agree or more not agree. So wait you as doctor get for tell you about that, about the malaria vaccine. So
I'll talk say vaccine skepticism. Now some very recent trend where we see for the healthcare sector where plenty people no one vaccinate because people they doubt wait they don't really put that inside a vaccine, why it be necessary, and plenty factors that they cause this vaccine skepticism. First of all, religious or views, and then plenty country people they know say white man not really like we, so they give it and then for reduce fertility. So plenty of these notions that they outside concerning vaccines. But what's be important for Nona say vaccine will be new concept. Vaccine we don't start as you don't talk, we don't BCG, polio, meningitis, all the vaccine they would already give a picking them. So this vaccine they not be new concept. Like this malaria vaccine, they start developing right for 1970s, 1980s, you see. And no be Cameroon be the first country for officially roll them out. But they don't test this vaccine for Ghana, they don't test them for Kenya, they don't test them for Malawi. These 3 countries they say this vaccine be effective to some degree, it protect. Vaccine, like any other medicine, they get side effects. So if na side effects people they fear, I would talk say, well, anything you feel drink, like people they take some medicine, say, oh my head, I take that medicine, my head turn me, I take that medicine, I push so my belly. It be necessary. And especially when you develop new vaccine, you go to study the side effects them. Okay, this now the side effects, nothing that's what we do. But SK the vaccine be efficient? Yes, on a scientific point of view, yes. SK will know how they don't produce this vaccine. Yes, we know how they don't make this vaccine then. Because the WHO or the labs, the way they be involved, they detail the process for how they don't make this vaccine. So I feel say we'll go beyond vaccine skepticism or just to talk say, well, people they don't like we say we'll not go take them. If it work, it really protect. Yes, if you don't show result, why I not go vaccinate my picking them? If you never show result, go for meet up doctor, ask well, what do you really think? Like as you do now, so I say be very important. What do you think about this vaccine? How they make them? What do you want? What to be your fears? I vaccinate my picking, I not vaccinate. Doctor go educate you, you see if you fear, and you will get more knowledge on vaccines. But me, if you say, no, in the end, vaccine be important. We don't take vaccine, we don't take meningitis vaccine, we don't take polio vaccine. I know, so I understand, say with COVID vaccine, people they be fear because plenty story they be there.
And from that COVID vaccine, where this fear
this is fear for malaria don't come.
Yes.
But vaccine no be new concept for medicine. And vaccine they really protect, they save lives. Imagine the number of people where they for die meningitis, polio, hepatitis. If this vaccine they not be there for protect we. So I feel say vaccine more reduce the fear or the skepticism and more try to understand, more be a bit more objective. Wait till they happen. Why this vaccine? Wait to be the side effects. Wait till I get for do if my picking experience side effects. So and then we'll see over time. We'll see the protection. SK be efficient. SK malaria don't really reduce. Like 3,800 people they be die for 2021 for malaria for Cameroon. That not plenty number. Over 3 million people then be affected with malaria. So if this vaccine feel really help we, why I go deny for taker? Then why are the first go hospital? Why are they even accepting me hospital day? Because vaccine they like medicine. I go simplify and say they like medicine. Yes.
Wow. Doc, we got one gift for you. Anybody can better Torpoh go to gift.
Well, thank you very much, country people. Thank you, better Torpoh.
But before you go, never finish.
Okay.
Before you go, I want to make there we like as you talk, we as a society will be very negligent about our health. And people they get that notion say maybe not only rich man they get family doctor, for example. Now only rich people they do health checkup. Some people and they talk like with pride that kind for 10 years now they never go hospital. For 10 years now doctor never see doctor. So wait to be any advice or health people if you give we actually we would they like the conscious people of this generation, which advice you feel give we for how we take care of our health? You know, I guess on my friend we go hospital for go visit some person, and I still go visit some person just by chance. It's just say, might just do this, check them this this. And then they check his BP. They still has a BP high. They try to almost admit it. Maybe they find the work I don't know say get high blood pressure. So which kind of advice you feel give we, you know, for how we fit, you know, be conscious and for take care of our health?
So I will start by talking, say, not be only rich people that you get this thing access to healthcare or family doctor. If you know say you don't get money, at least once a year check your blood pressure. That one no cost anything. If you enter pharmacy, just back moon check my blood. They tie your hand, they check, they tell you say be fine. Check even your this thing, your pulse, that's your heart, how your heart the beat. Yes, that simple thing them. And I think more and more all we get maybe picking or cousin or person who will know when a doctor or a nurse. If you even just asking me check this basic thing them once every year, it be very important for we. Because you need to know sick that they hide and they go yes more time or you don't fall, it be the worker or it be they find it come meeting then he fall die. I wish we not be wish if you get sick you never ever check 10 years as you did talk. So but my general advice for young people, first of all, in addition to this yearly health check where if you do a basic check, now say we first learn how to chop healthy. Plenty young people they need to chop healthy. First they need to chop, they don't know waiting for chop, how for chop, which time for chop, would they chop for midnight, would they chop for any kind, and all these things they be health get health effects because as you be young your skin your body feel compensate but the more you the old the more your systems they fail. So many of these things them if you never live healthy, if you never chop healthy, many of these things they go start reveal for old age because your skin the system they slowly break down. The second thing I say we learn for do exercise be necessary. Even if you the worker, even if you want job, plenty of we would drink, we drink like 1 bar, we drink the whole river Uri, but no one eye sports. And all the things they be very sports exercise be really important for the skin because they regulate plenty things there. 30 minutes, you take your small sport shoe with small pang, you don't jog for quarter. It be like say you be foolish man when you do that kind of thing, but you really protect your health. So and then third thing for avoid things like excessive drinking. We know say we know if take people say we no drink. They go surely close better studios. They will talk that in, but we'll be able to regulate as we drink alcohol, and then even things like smoking. We now some new phenomena, shisha, all these things there. More avoid peer pressure or trends because with the see I'm say fine, my friend he do I enjoy, but in the long run, you go really pay the price. So this kind of thing, them if it no be necessary, I no get for smoke for show you say I be big man. I no get for drinks so they are drunk before I tell before you know say I be strong man. So now small advice that I feel country people them.
And then we are experienced as health worker. Which sickness you feel say they affect young people the most, or like the highest? I mean, the young people you don't see and for hospital you don't receive, and which illness or which sickness you see and say it affect young people the most?
So I think in other list for me, from my experience, the two top ones. First, mental health problems. Plenty of young people they suffer from mental health problems where they don't know depression, anxiety, that kind of thing. That sick, that suicidal tendencies even. So I think some really big challenge where plenty will get for sensitize more young people that may they know about mental health challenges. And then the second one is gastritis, because especially because people they don't know as they chop, people they need to chop fine, people they just drink anyhow, they do just some behaviors no way not really be healthy. So I feel say that to sick them, at least in my experience, be very recurrent amongst young people. Yes.
For this mental health issue, I want to more talk about that small because I feel it be neglected. Maybe not as this generation don't get that consciousness because one or two people they talk about and small, but on a general scale it be very neglected, especially for our society, for Africa. People if it's a white man it's in, they don't believe in therapy. You talk about therapy, they say you crazy. I'm a black man, I don't need therapy. So which kind of advice you think give person way to go through this mental health challenges? And I feel say for hospital, I don't know if you go there if it be possible say you feel some way you go hospital go talk say you feel like say you get mental health challenge
and if they feel refer you, because I don't know if people they do it, because a lot of times people they write me, oh I want to talk with therapists. I feel like say I need to talk with therapists. Some people they get that consciousness, but plenty of other people they don't get the consciousness. They just go around be harmful to themselves and to other people, but they don't know that because of say inside them they don't get that. So wait if you advise people about this mental health, like which kind tip if you give people about that?
So first, I'll talk to mental health, not be white man is sick. All we every day, because of the different pressures we will be under, will be exposed for many mental health challenges. People they come out for broken home them, where you don't watch as small picky, you see your papa, your mommy, they fight all the time them. This thing that they get effects for you as you go. Or your mommy don't tell you, oh, daughter, you know, go ever prosper for life. All this kind of talk, that when you reach a steady level, maybe you fail exam or thing they need to work out fine. You feel all the thing that you feel will come back for your mind. So we will be exposed, we really exposed, because even of the way we don't go, where our family they be structured. So mental health is a real challenge. What do you feel do if you get this depression or if you get any of this mental health sick? The first thing, first of all, na for agree. Say, as I did so, I know they find something they worry me. I get problem like this. I will agree. Now, the second thing, for seek help. What do you feel do? Okay. Wait till first of all the cause am. If you identify some factors, like some people maybe na anxiety, I be really anxious about some certain thing. How I feel manage them? If I don't feel manage them, I go hospital, go see doctor. If doctor feel say he pass, he go refer you for thing where you call him counselor or psychiatrist or psychologist, depending on the level for the mental health trouble. You see, and so as we seek more care, I feel say psychologists, psychiatrists, they be very well equipped for help you with whatever the problem, the challenge you face am. So I feel say make we accept them. Say sometimes them yes, no be just sadness, now really depression. That feeling where you wake up for morning, you know and do nothing, you know one chop, you know one just life just be void of meaning.
See the way we used to like for that,
you know one do one again. If the first thing I accept say yes, I get problem, I be depressed, and then secondly for seek medical help.
Interesting. Doc, before you go tell me about you, I mean for the beginning we tell you to get some startup, so tell me about your startup.
Okay, my startup now Jalfa Health.
Okay.
And with the struggle for digitalized healthcare, the healthcare sector, we don't tire for the see people that work out hospital books, or when they don't get that, so when they don't lost hospital book 500 years, you want can you see my meal plentify. So wait till with the struggle for do in essence now for move all this paper them for bring digital systems with patient for hospital, doctor fee enter all your file them, you there for house, you get your this thing for your phone, you get your account with all your healthcare details there inside. So that people they go stop for the spend carelessly or for because I don't lost hospital book I get for buy new one or history they get for start again. So now the first thing that second now also for increase access to care. So thing them like telemedicine will be very important. So if I don't see my doctor one time, sometimes the people they need to follow up with their rendezvous now because the doctor far. I come on man can do I see doctor first time. For come out again because my skin they fine. I know. So the thing the telemedicine will help you. If you even call your doctor, hello doctor, now so my skin the doctor will tell you okay maybe they fine, you know they fine. Can this day, can this day. Simple thing the like appointment system as well. Where na very important thing. Plenty of we will not like for go hospital because you go in the fear say oh you go stand up for long line, you could take the whole day. But if we get appointment system where I know say well I don't schedule my appointment for 9 o'clock. 9 o'clock I come, I see doctor. I don't go me. It go reduce, it go really, I feel it go improve access for hospital. Plenty people will really like for go hospital. So with the struggle for think around small solutions, them tech solutions, we feel really help improve the healthcare sector.
Okay. Dr. Bill, thank you plenty for the time we don't spend our way and you don't really enrich we with plenty knowledge about especially our healthcare system for Cameroon and you don't give it tips and thank you plenty. I mean before you go give me last advice for any medical student where they see you now and where you see this school maybe they here too with the calculation I will ever finish it so maybe by the time I want a word or end which advice you go give where they go through stress, where you feel say the thing hard, you try to give up, you know. Which advice you get in medical students?
I will tell you say when no go end. You go finish. Anything we get beginning get at end. So you go finish. Now for do your best, your very best. And one thing maybe really helped me as a medical student, I said I be really observe a lot. So plenty of time them as a student you want to show say you know. But if you just really sit down quiet, you take some time for listen, for learn, for see as people they do thing them. I feel say you go really learn a lot of things. And if you feel say the thing really be stressful for you, seek help from your family, call your family, because family be a big source of encouragement, of support. This journey no be easy. 7 years where you did one place, you feel like you didn't progress. So call your family, call your loved ones and your friends, and from time to time, may they be a source of warmth and encouragement for you.
Wow, Doc, thank you plenty for this time we just spent away.
Thank you.
And we hope so we'll see you again for better Torpoh next time.
I go come anytime we invite me for better Torpoh, I go come to talk to contribute to them.
Bye.
Bye.